Yeah. Now, Mr. Nshuti, can you tell us a story from Rwanda about water supply?
Rwanda is one of the countries that is doing well in terms of water supply, but there's still a big issue of equity and inclusion, reaching out to people with vulnerabilities, poor communities. So while the coverage is quite good, but the infrastructure is not inclusive enough. As WaterAid, we are encouraging and all the stakeholders to be more inclusive, to reach out to the hard to reach and poor and marginalized groups.
How are the policies?
The policies are actually good, but as I said, there needs to the issue of implementation. I don't think, looking at the infrastructure and the policy, there's a bit of contrast between the policies and the implementation. So there is a bit of lack of monitoring of the policy implementation.
What is your recommendation?
My recommendation would be to look at the policies again and see the gaps in terms of equity and inclusion, see if these policies are inclusive enough, and have a monitoring system to monitor how infrastructure, the design of the infrastructure, the design of water points and sanitation facilities, for instance, to see if they are more inclusive, so that they're usable by all.
Yeah. Are the strategy targeting uniform access?
Yeah, uniform access. I use the word equitable access, because equitable access means everyone has access to the services. Because what happens is that we have services, but the variability of services does not equate to equitable access. Yeah.
As WaterAid, what are those, which strategies have you laid to ensure that everyone accesses water?
That's a very good question, actually. WaterAid, we are pioneering the equity and inclusion in Rwanda, working with other stakeholders, other NGOs and local partners to mainstream equity and inclusion in our programming, in our strategy. So, for instance, we are organizing a national workshop on equity and inclusion, which we would like to bring decision makers around the table, so that we can discuss issues of equity and inclusion, discuss issues of poor and marginalized service delivery, to delivering water services to poor and vulnerable communities, having designs that are inclusive, that take care of different forms of disabilities, gender, elderly, children, and people living with disabilities, people living with HIV and AIDS.